Next step is to treat. You want to address all of the contributing factors when it comes to lowering your blood pressure. Anxiety, alcohol abuse. Alcohol abuse being defined as having more than 4 servings in a sitting for a male or 3 servings in a sitting for a female, or having more than 7 servings in a week for either a male or a female. For sleep and activity factors, you want to make sure you're getting 7 hours of sleep every night. You want to make sure you're meeting your recommendations for aerobic exercise, resistance training, and avoiding sitting. For nutrition factors, you want to make sure that your sodium intake is not excessive. What I recommend you do, first of all, is prepare your own food. The majority of people who have high sodium intake have it because they are eating out and ordering in, or they're having packaged meals like frozen dinners. When you buy food that's been prepared by someone else, their goal is not to help your blood pressure. Their goal is to get you to buy more. And salt is a great way of doing that the food industry has latched onto. So if someone else is preparing your food, it's more than likely going to be high in salt. And if you're uncertain, I would download the MyFitnessPal app and log your food intake just for a 24-hour period and figure out what your sodium is but using the app. If it's 1,400 milligrams or higher, then salt is a contributor to your high blood pressure. If you can't figure out what your sodium intake is because you're eating in places that don't have nutrition labels, that's another reason not to eat at those places. Absence of fruits and vegetables is a factor that should be addressed. You want to get 5 servings of fruits and vegetables a day. And obesity is an important factor. Having a BMI less than 25 is the goal. Now, I recommend doing all these things and doing all these things and doing all these things. They don't only help high blood pressure, they help quality of life and overall health. But it's important to keep in mind that sometimes it's necessary to treat high blood pressure with medication. And this is really a discussion to be had between you and your primary care provider. One reason to treat with medication is just very high blood pressure. Like maybe for my patients, it would be persistently 160 systolic or greater, or some kind of sign that the blood pressure was causing end organ damage, like headaches, blurry vision, chest pain, shortness of breath, leg swelling. But this is really a discussion that should be tailored to you and your treating provider. And the other reason I would consider medication is, let's say someone is obese and we do a 3-month, 12-pound weight loss goal and they haven't lost any weight and their blood pressure is still high. It's worth starting a medication. The thing to think about with medication is it's not a lifelong sentence to take medication. It might not be the right time in the person's life to lose weight or to cut back on alcohol or to treat their anxiety. What starting on medication does is it reverses the damage to the heart so that you buy yourself time to make the lifestyle changes that will allow you to no longer be on medication. But you can pause and reverse damage to the heart by taking medication. It doesn't commit you to being on medication for the rest of your life if you're able to make these lifestyle changes over time.